These are the Joneses. Mr. Jones is a pretty regular guy. He has a job in construction and likes to fish. Mrs. Jones works at her church and likes to go to yoga. They also have 2.5 children. Unfortunately, Mr. Jones has suffered some bad luck and was laid off from his job. Because he's not providing for his family, he feels like a burden. His energy is low and he's become irritable. He might be suffering from depression. One day, while looking at Facebook, Mr. Jones discovered the Captain Awesome campaign and learned about mental health services available through Shasta County Health and Human Services. So Mr. Jones went to the office to learn more. He meets with the Access team at Adult Services. When someone qualifies for HHSA services, they link them to other resources. This time, they provided Mr. Jones with a referral to Shasta Community Health Center, where he can get help for his anxiety and depression. But Mr. Jones is concerned that he can't afford to see a doctor or therapist. Neither can Mrs. Jones, who is struggling with breastfeeding. The Access team member sends him to a community mental health worker who gives him information about Medi-Cal insurance coverage. She also suggests that the family checks out the Women, Infants, and Children program, more commonly known as WIC, where Mrs. Jones can get breastfeeding support. Mr. Jones applies for Medi-Cal through the See For Yourself app, which only takes a few minutes. While there, he also applies for CalFresh, also known as food stamps, and the CalWorks Employment and Training Program. He soon learns the family will receive benefits from all three programs and goes to CalWorks to begin the Welfare to Work program, which gives him the skills and support he needs to help him transition back to traditional employment. On Saturdays, the family goes together to the grocery store to buy fresh vegetables and fruits with their CalFresh benefits. The Joneses love the Healthy Shasta website because there are great recipes, nutrition information, and fun exercise ideas for the whole family. Later at the WIC office, Mrs. Jones talks with a peer counselor about her struggles with breastfeeding. Her peer counselor thinks that Mrs. Jones might be suffering from postpartum depression, and that might be affecting how she talks with her other children. To help Mrs. Jones learn some tools to help her reconnect with her kids, her peer counselor refers her to the Positive Parenting Program, better known as Triple P. After checking out what's available on the Triple P Shasta website, Mrs. Jones learns that there are great parenting classes available at the kids' school, paid for by the Children's Services Branch. Little Susie and Jenny Jones will be starting school soon, so Mrs. Jones takes the whole family to the public health clinic to update their immunizations. The kids are scared to get their shots, but a nurse cleverly distracts them. Before they know it, the shots are done. Mr. Jones is ready for a smoke break, but he won't get one on the HHSA smoke-free campus. Instead, staff are happy to provide smoking cessation information for Mr. Jones. In his CalWorks classes, Mr. Jones is encouraged by his facilitator to apply for an eligibility and employment job within the HHSA. The hiring panel agrees that he'd be an excellent fit, and he is sent to Human Resources to complete his paperwork. Without knowing it, Mr. Jones has already interacted with HHSA's business and support services. This branch also processes the paychecks for clients who participate in the Shasta Faces program with businesses in the community. With support and tips from HHSA programs, the Jones family worked their way back to stability and wellness. And now, through HHSA, they have a chance to give back to the community that assisted them. Now that Mr. Jones is working with eligibility staff, he can use his own experiences to help others who have suffered setbacks in life. There's something for everyone at Shasta County HHSA, so keep up with the Joneses. Visit us at shastahhsa.net or follow us on social media to learn how we can be a part of your family.